Hi, I'm Dr. George Cromack with RenewYourself.net, and I'm here to talk to you a little bit about disc degeneration and showing you a few practical ways that you can slow that down, make it feel a little bit better, and kind of halt the progression of that. Disc degeneration is an epidemic problem. 95% of the population by age 45 shows signs of degenerative disc disease on MRI or disc bulges. This is what a healthy vertebrae, two vertebrae and a disc look like. That's going to not only be a great shock absorber, but it's going to create lots of room for that hole where the nerve trunk comes off the spinal cord and the bone surfaces are going to be smooth. And what we see in the average person is usually by 50, we've got a few areas that look like this where the disc is starting to degenerate. That decreases the space between the two vertebrae, and that hole where the nerve trunk is coming out starts to get suffocated, and we start to get bone spurs laying down to actually kind of stabilize or immobilize the area so the disc isn't taking too much more stress. So that crowded foramen or hole where the nerve root is coming out, combined with bone spurs coming forward from the posterior joints and backward from the vertebral body, leads to something like that nerve root getting strangled with a piece of barbed wire. And then the end result would look something like this, where that disc just totally disintegrates and these bone spurs actually fuse together, and this now becomes a immobile block of calcium, and you can just see almost like a pair of wire cutters, that nerve root getting strangled. And that's a couple of problems. We're not going to have much mobility, decreased range of motion, and if that is how life moves through your body, it comes from the brain down the spinal cord and then passes via these nerve roots in between the vertebrae to every cell, tissue, organ, gland in your body. We got a major problem with that flow of life through your body, and that disc in itself can be pain sensitive when it starts to degenerate. So the reason this starts to happen is just, the disc is dependent on blood supply from the cartilage above and below the disc to infuse nutrients in there and feed it. And so that means just kind of getting a nice movement in there to kind of cause that diffusion of nutrients and blood into there, because your disc no longer has a direct blood supply after you reach adult maturity. So two tools that I found really useful are, one, the Pettibone wobble chair, particularly for lumbar disc degeneration. This is a portable version, and that just goes on your seat. And by sitting on that, we can rock forward and backward, pumping that disc. And then we can go side to side. And then we can go in circles to the right and to the left. And what that just causes a lot of pumping motion on that disc, strengthens some of the ligaments around the disc, and it's going to slow down that degeneration process and relieve some of the back pain to some extent. The other thing that's, and this is available on my website, RenewYourself.net, you can put it on any chair. The other thing is getting traction or inversion traction, and the Ohm Gym, which is also available on my website, I find invaluable. If you don't have high blood pressure, this is great. It just tractions out all the disc in your spine. You can actually do yoga on this while you're in inversion. And that gives the benefit of increased blood supply to the brain and endocrine glands while you're getting traction, and actually relaxes a lot of the muscle tension in your back. So that is another excellent tool. And if you do both of those daily, you're going to significantly slow down the wear and tear on your spine. That's Dr. George Cromack from RenewYourself.net, and that's your health tip for today.